Hi, I'm Dr. David Dobson. Welcome to Conversations. Today, my guest is Dr. Maryam Memar Zadeh. Maryam is an associate professor of operations management at the Faculty of Business and Economics at the University of Winnipeg. Her teaching and research interests include risk management, operations management, supply chain management, and healthcare management. Her research work has been published in several academic journals. Maryam obtained her PhD from the Ivey Business School at Western University. Today, we will discuss her research on service risk management in healthcare. It's a great pleasure to have you with me today, Maryam.
Thank you so much, David. Thank you for inviting me. I really appreciate that.
To start off, please tell us what operations management entails.
Absolutely. I love this question, in fact. Well, the way that I'm going to discuss this, David, I usually start my operations management class like this. I think of businesses in terms of human body, just like a human body that is composed of several subsystems like respiratory system, digestive system, circulatory system, skeletal systems, nervous system. Any business is composed of various subsystems, right?
Yes.
What are those subsystems? Operations management, marketing, human resources, information system, and finance and accounting, right? In our jargon, you and me in our universities, we often refer to the subsystems as disciplines or streams, depending on where we work, right?
Yeah.
So operations management is one of those subsystems of organizations. And just like in human body, that every subsystem has a responsibility and they work in an integrated manner to create some sort of outcome, the human body. In organizations, all the subsystems, operations, marketing, human resources, information system, and finance, they work together to create an organization that creates some sort of benefit for itself and for customers, right? Now, operations management specifically here is, in my opinion, the best analogy that I have for it is like digestive system in human body.
Okay.
How? Well, the digestive system is composed of like our mouth, our teeth, and esophagus, our belly, intestines, right? So there are some parts in our system, in our human body, that work together to convert what we eat and drink, like the food and beverage intake. They convert those into micronutrients that are essential for human function. So they turn what we take into some desired outcome for our body. Exactly the same function happens in operations management. So in terms of operations management, the subsystem of operations management is composed of all those resources that work together towards converting the inputs of our system into a desired outcome for our customers. Now, let's dig into each of these factors. In terms of the input, in terms of the system's input, what we have is a combination of the organizational resources that we have, and the resources can be tangible or intangible. Tangible resources are our workforce, our machinery, our working space, for example, everything that is basically tangible, right? And our intangible resources are more subtle kind of resources, such as the knowledge of our workforce, the trust that we have created over years with our suppliers in our relationship with them, the R&D specific efforts that are developed for extracting innovative ideas from our meetings. All of that are very subtle and intangible resources, right? So this is the input into our system. This input during a conversion process, production process, turns into a desired outcome for our customers. And who's the customer? Customer can be our internal customers, like my colleagues here would be a good example of internal customers, right? And they can be external individuals or businesses. So we have external customers as individuals, or in B2B settings, businesses. So the job of an operations manager is basically to ensure that they design and maintain the system that takes all the input, converts them into an output that benefits or desired by some sort of customers, and create value out of that benefit to the organization. So it's more like a cycle that is supposed to be optimized all the time.
Okay.
Finally, the last thing that I would like to say about operations management, again, getting back to the analogy of human body, just like a human body that is supposed to be working in an optimal manner, a system that an operational system is supposed to be working in an optimal manner, meaning that every time that the system is converting the input into output, it is supposed to be doing that in the most effective and the most efficient manner.
Right.
So that would be, in a nutshell, the job of an operations manager in organization, to create an optimal system that is efficient and effective in converting inputs of the organization into desired outcome for customers.
Your research and teaching focuses on operations management. What brought you interest to this area?
Very good question, David. Well, when I was doing my undergrad studies, my major was on applied mathematics.
Okay.
And I was about, like, the last years of my studies, I started taking courses that were in the intersection of mathematics and management. Like operations research was one of them. And the one that I had was management of industrial organizations, for example. And throughout this couple of courses that I took, I realized, oh my God, there is this specific major called business, in which you can use what I've learned in mathematics and apply it into the real life businesses. And in fact, in that course in industrial organizations, managing industrial organizations, our professor taught the entire course using cases.
Okay.
Oh God, I fell in love with the concept of case study, because all of a sudden it opened my eyes to the reality. Oh, this is the application of mathematics. So in reality, we could do something with what we learn in science. So that's when I became so interested in operations management, specifically because I had this undergrad in mathematics. So I did my master's in production engineering, which was very close to mathematics. So that was a good point to start learning about management. And after that, well, you can't do operations management without understanding innovation and technology. That's why I immediately after finishing my production engineering, I started another master's in entrepreneurship and innovation management. Yes. And the funny thing is that, well, I was expecting, well, when I'm done with the second master, I'm going to start work. I'm going to either be an entrepreneur or I'm going to join the industry. But then once that I was done, I was like, I'm missing school so badly. So I decided to get back to school and do my PhD.
Yeah. Probably more question to answer, I guess. More curiosity for you.
Exactly. That's true. Yes.
Very nice. For your doctoral work, you studied a long-term care facility.
Yes.
Can you please share what your study was about?
Sure, of course. Well, my primary line of research is on a subcategory of service systems that are called human-centered service systems, or HCSS.
Okay.
Now, what is specific about HCSS? These are organizations or service organizations that are human-centered, in the sense that humans' ideas, beliefs, needs, wants, expectations, and even perceptions fall at the center of value creation for the customers. So the value creation for the customer unfolds dynamically
Yeah.
through the interaction of human beings with each other. And you can imagine all those perceptions, beliefs,
Yeah.
and everything comes into the play as they are playing their role in organizations, right?
Okay, yeah.
That's why we consider human-centered services as complex adaptive systems. They are evolving all the time, right?
Yeah.
So my interest was specifically in this area, and more specifically, I wanted to understand in the service systems. Well, first, let me give you a couple of examples of HCSS. Well, I would say education services, like you and I work in universities. These are perfect example of HCSS.
Yeah.
Retail stores, financial institutions, government services.
Okay.
Most importantly, healthcare is a perfect example of human-centered services. Now, within human-centered services, my intention was to understand how and why do HCSS need to ensure compliance of their employees. Why I became interested in this specific question? Well,
Yeah.
that has a story. Almost every day, when I was doing my coursework during my PhD years, almost every day, I was reading the news to find a research question appropriate for my dissertation, right? And there was almost no single day that I couldn't find an example of non-compliance somewhere in HCSS, specifically in HCSS, that was causing major harm either for the employee himself or herself, or the organization, and or the customer of the organization. And let me give you one simple example of one of those instances that I read, and I wrote that in one of my publications. Like in this specific case, a teacher was supposed to chaperone two students, a male and female, during a field trip. And according to the policies of the school, during a field trip, the teacher is responsible of ensuring that the hotel rooms are assigned by gender. Whereas in this specific case, the teacher decided that it is okay if the two students, which are opposite sex, share a hotel room. Not only that, even worse was that he decided that they can take alcohol during the field trip. So it turned out as a horrible idea. Obviously, it caused major scandal for the school. The teacher himself was called for a hearing by the ministry, and all the complications that you can imagine after that event could happen. The families were so mad and everything, and of course, it's not even moral when we think about the situation. It's not moral. These are kids, and we have a responsibility towards them, right? You and I are in the education sector, and we understand that really holy responsibility towards our students. So that turned out to be a very bad idea. And when I was reading about it, and I'm like, oh my God, how comes? Like, no one couldn't prevent that event from happening. Why it must happen? And what could the organization do from the beginning to be prepared to prevent an event like this? And what are the outcomes of events like that for organizations? So seeing this type of cases in real life businesses made me to think that, well, I should ask this question. How and why do HCSS ensure the employees' compliance? So I started to search for the right place to do my research. And of course, healthcare is a perfect place to do a research like this, specifically because the outcome of employees' non-compliance can be unbelievably harmful for the employee himself or herself, the organization, and most importantly for the customer, because we can basically kill them, right? And it happens. It's a real fact. So healthcare was a perfect ground for doing my research, but there are other considerations. I needed to study a place that is complex enough that is, well, first of all, they let me to do this study because I wanted to do a qualitative research that takes a lot of interaction with personnel and a lot of, like, I needed to go and sit in a place and watch the entire operations as people are performing their operations day to day. And so I needed to get permission for that. And so the organization that I was choosing was supposed to be an open to research organization, basically. Fortunately, I found this organization, this long-term care facility that was quite open to this research. And particularly when I explained to them the purpose of the study, they were like, oh my God, this is a problem that we are dealing all the time. So we would love to know about the outcomes of this research. So fortunately, they opened their door to our research and we could start this study. But just quickly, some of your audience might not be quite familiar with the concept of long-term care in Canada. So long-term care facilities are organizations that provide 24-hour services, both clinical and non-clinical services, to individuals who are no longer capable of taking care of their day-to-day needs. So it's a long stay place, a place for staying long term. And individuals who are in these places are often with complex care needs, right? Most of them fall within the category of seniors, in fact. But once in a while, the residents can be individuals who have lost their mobility, or sometimes they are in more advanced stages of dementia. That's why they need this care. So this whole context of long-term care was unbelievably appropriate for my research, mostly because it was HCSS. It fell within the definition of HCSS. It was high risk, so I could assess all aspects of employee compliance. And at the same time, the third reason was that I'm sure that, David, you can relate to that. But we have our grandparents, people who are either already in a long-term care or they are at the verge of being there, right? So it is important to study these organizations to help them from management perspective to improve their services. And unfortunately, I should tell you this, that David, this is a context that has received very little attention by management scholars. And I always wonder why. The fact is this, it has very fertile ground for management studies. They are often very open people to research because they are highly educated nurses that they are research oriented, so they are willing to let us in. So I'm hoping that maybe your viewers, after watching my interview, could consider studying long-term care in the future.
What did you learn from this case study you did for your doctoral work?
So, David, what I'm going to share you as for my finding is not limited to what I learned specifically during my doctoral years, because I extended that study after I graduated and I joined University of Winnipeg. So I created two different streams of research out of that, one in high reliability organizations and one in, again, the same concept of employee compliance. And I used a new name for it as operational integrity, or what I call OI, as a proxy for employee compliance. And I took that in a new level by designing a survey and analyzing data and creating this huge model with over 10 constructs in that model. So this is the next step of our research that I'm going to share with you in terms of the results. So what we found most recently is that in order to achieve high levels of operational integrity or high levels of employee compliance within our operations, we have to consider the fact that employee non-compliance might be intentional or unintentional.
Okay.
And it is a very interesting finding by itself, because especially in operations management field, we make this implicit assumption that non-compliance is something that happens unintentionally. You mean to follow the requirements, something happens and you don't do it. But in reality, we found that the majority of non-compliance cases are in fact intentional. In other words, people willingly choose to deviate from the requirements of planned operational tasks. Now, we categorized these two intentional and non-intentional non-compliance cases into two categories based on what causes them. The first one is called, what we called it actually, not that it is called, we called it as ecocognitive factors. Ecocognitive factors are the factors within the ecology of, or the environment of the business system, such as high levels of workload, or the amount of variability that we have in our day-to-day activities. The more variability there is, the more chance of missing tasks. So it causes unintentional failures. And also, as I said, its name is ecocognitive. So there is ecology and there's also cognitive factor. You sometimes don't remember to do a task as you were supposed to do it. It is totally unintentional, but you miss it. So that's why we call this category as ecocognitive inhibitors that are preventing people from accomplishing their tasks as they were planned. Then the second category is called, again, we called it as social psychological inhibitors. And social psychological inhibitors are what inbreed the intentional failures. And they are basically, again, psychological factors and social factors, right? The two of them together. Social factors are those factors that are happening within our environment, our relationship with our colleagues, how that kind of relationship might make people to take more risky actions, how people might promote non-compliance to each other, and how your culture can turn into a culture of non-compliance, basically. That is that part. And then there's this psychological factor within every individual, or kind of what I would call predisposition of every individual. Like if I have a risk-taking propensity, I'm more prone to be non-compliant, even though, like, I don't mean any harm to anyone. That's not the point. From intentional, we don't mean that the person is trying to sabotage the system. No, that's not the point. They just don't have they just don't feel like doing the task. That's the best way that I can explain it. So these two inhibitors together prevent people to follow the task. And then organizations can introduce two types of enablers that we have called completeness restorative and compliance stimulant enablers, which in a way can reduce the negative impact of inhibitors. Now, in combination, we consider these four factors as antecedents for operational integrity. And in return, if we can have high levels of operational integrity, then we can have a system in which people learn better, safety of our employees are preserved, and at the same time, the organization is capable of reducing its operational risk and achieving its strategic operational capabilities. And that was one of our most interesting findings in this study.
As we know, the COVID-19 pandemic outbreak had a major impact on Canada's long-term care facilities. Does your research resonate what happened to those facilities?
Yes, David, this is a very good question. And in fact, I have addressed this whole issue in one of my publications with Dr. Nicole Haggerty, who was my ex-supervisor basically at Ivey Business School. I invite your audience to take a look at that study, because that's where we holistically look into the long-term care system in an industry level, in organizational level, team level, operations level, and frontline level. And we explain why these events could be prevented if we had taken a different approach from the beginning and we had followed high reliability organizations principles. But because it's all about high reliability principles, I'm not going to go into that direction. As I told you, that's a whole different stream of my research. But from an OI perspective and employee compliance perspective, what you're saying is absolutely true, because Nicole and I, we coded a report that was created by the military after the military took over 5 long-term care facilities during COVID. So when the pandemic hit so badly, some of the nursing homes were totally in default mode, and they couldn't do anything appropriately in terms of managing the situation. So the military had to intervene and take over those long-term care facilities, and they produced this report, which after coding it, Nicole and I were so surprised to understand that based on that report, 30% of all the citations in that report was related to managers' mismanagement practices, and basically their mistake in creating a work plan that prevents from outbreaks. Whereas the remaining 70% of citations was all about employees' non-compliance. And I can give you a quick example of that. Based on the report, in some of those nursing homes, when individuals were treating one COVID-19 patient, they wouldn't change their gloves or wash their hands when they wanted to meet the next person. And when the military staff questioned them about this, they would say, well, this is exactly the same disease. Why do we need to change the gloves? Which is absolutely wrong. We all know that, right? And obviously it is in the procedures and policies of all nursing facilities. I have seen it personally when I was doing it back then. There was no pandemic or anything, but it is already there. You should change your gloves as soon as you are moving to the next patient, right? So as simple as that, and with not following those procedures, all of the pandemic got to the stage that caused a lot of casualties, specifically here in Canada. So yes, I absolutely relate to that, and I'm hoping that in the future we can avoid situations like that if we can.
So what is your advice to long-term care facilities?
Well, David, I would see my research in terms of more of HCSS than specifically long-term care facilities, as I told you before. Obviously, for long-term care facilities, again, as I told you, I see them as a system, not as a specific organization that needs to be worked out. The whole system has problems, and I have identified that in the research that I've told you before. But in general, for managers of HCSS, I believe my best message would be that they should be aware of the fact that employees' non-compliance can be intentional. And the intentional non-compliance, based on our survey, was significantly causing operational integrity to decrease, whereas our ecocognitive inhibitors, they're marginally significant. So that's a very important findings. In other words, main cause of lack of integrity in an operational system is not unintentional failures, but it is intentional failures. So that's a very important consideration that managers of HCSS should have. One other important factor that I think we should let the managers know is that even though operational integrity is a concept that is related to day-to-day operations of organizations, its long-term impact impacts organizations' ability to realize their strategic intentions in terms of their operational capabilities. So the assumption that everyday tasks, if there are some errors here, nothing is going to happen. You are totally wrong, because it's eventually going to impact. It rolls up into your inability in achieving your strategic capabilities, which is going to harm your organization in long term. So that would be my two important advice to managers.
Do you have any advice for students who wish to continue similar types of research?
I actually do, David. I have two suggestions to students. Like when I started this research back then, like 10 years ago, well, people who were from operations management field, they are very mathematics oriented people, right? And they all, many of them were discouraging me about, well, you're going to do a qualitative research. How comes? Like with qualitative research, what do you want to be? And I'm like, well, I want to be a professor. Nothing other than that. But I had other people who encouraged me. I have beautiful professors. Dr. Nicole Haggerty is one of them. Dr. Larry Minor was another one. They kept encouraging me, continue doing what you're doing, and it is worth the effort. So don't let anyone discourage you. And even though what you're doing is not mainstream at first glance, you can gradually make it mainstream in the future. You don't have to do it right away. The second advice that I have is that there are some specific contexts, such as long-term care, that have not received enough attention. And you can find those contexts and you can build a career for yourself working in that specific context by creating a research that is really novel. And more importantly, honestly, I think the most rewarding part of my life is the fact that my research adds value to long-term care management. So I think people should consider that fact also when they are choosing an area to do their research in the future.
Thank you very much for your time, Maryam. Have a great rest of your day.
Thank you so much, David.